and marking National Cancer Survivors Day. Later this hour, I'll speak with the Dean of Columbia's School of Nursing about her own breast cancer journey and about the importance of getting those screenings. June marks National Cancer Survivors Month. According to the American Cancer Society, more than 2 million new cancer cases are expected to be diagnosed in the United States this year. National Cancer Survivors Month is an opportunity to reflect and honor cancer survivors, support those on their journey, and remember loved ones who have passed. It's also a call to action for research, resources, and increased public awareness to improve the lives of cancer survivors. Joining us now to share more is Lorraine Frazier, a registered nurse and the Dean of Columbia University's School of Nursing in New York. She's also a breast cancer survivor herself. Lorraine, thank you so much for the time. I was reading about you, and one of the things that I was struck, when you had your diagnosis, you mentioned that breast cancer was humbling, but also you say it's not a death sentence.
No, it is not. And you know, for patients and people who are newly diagnosed, they need to understand that. Of course, cancer is nobody ever wants to hear that they've been diagnosed with cancer. But I wish I had been able to see myself today, 2 years ago. It's been 2 years since I was diagnosed and treated. It would have been so helpful to me. And that's why I want to share my story, because when you're going through any type of cancer, you want to see people like you. You want to hear from them. You want to hear that they've been okay, that they're doing fine. You want to hear that there's reason for hope. And I, as part of my story, Alex, want to share that there is reason for hope. I know that people are being diagnosed at a younger age, but I will tell you that our research and treatment for cancer is really improving so much every year that it's better today than it was 5 years ago. So there's a lot of optimism to be had for those newly diagnosed patients and for patients who are survivors, to know that the treatment is and the research is amazing today. So listen to those providers. You know, the first thing that you want to do is you want to look on Google and you want to figure out everything that's going on in your story. And I'm here to say, don't do that. Listen to your clinicians and partner with them. It's so very important.
Well, and Dean Frazier, one of the things that you kind of alluded to is younger people being diagnosed with cancer earlier. Can you talk about the importance with some of this new guidance about lowering the ages for routine breast cancer examinations and colon screenings?
Yes, I mean, we are lowering the screening guidelines. I can particularly speak to breast cancer. We're now looking at 40. And we're changing the guidelines also because there are people that mammography doesn't pick up. I was one of those. I never, ever skipped mammography in the last 30 years. I have no family history. I never expected to have breast cancer ever, but it didn't pick up because I had dense breasts. And so starting in September, every mammography screening institute in this country will have to let their patients know that their breasts are dense. We'll write them a letter. So, you know, screening, know your risk and screen appropriately. One of the things with colon cancer, the first symptom is blood in your stool. Make sure that you pay attention. You know, it's so easy to think that you're not at risk. Nobody ever thinks that they're going to be diagnosed with cancer. But please, please be your own advocate and do that younger. Learn as much as you can and stay in touch with your healthcare providers. Always get screened. We need to catch it early.
Certainly. That's great advice. And Dean Frazier, one of the things we also know, unfortunately, that people of color are dying from cancer at higher rates. I mean, what can be done about that?
It's about screening.
Yeah.
Come. I mean, people of color, we know, tend to wait longer. And we need, I mean, the best thing you can do is get screened because we need to, if we catch it early, your chances of doing well are so much better. That doesn't mean that we can't treat it when it's later. It's amazing what we're doing with cancer today. It's almost becoming a long-term disease in many cases. But for everybody, don't be afraid to come to your providers. They're here for you.
Well, Dean Frazier, I have to ask you, because we know you've spent your life in nursing, but what was it like whenever
Yes.
you switched roles and became a patient?
You know, in some ways, it really enlightened me because, you expect healthcare providers to be technologically competent. We expect them to know right patient, right dose, what to do. But we also, the patients need to know that you're there for them. You may have given chemotherapy infusions 1,000 times, but to that patient, it's their first time or second or third. And you need to be there for them. And it was very important for me to see that in my providers, that touch, that moment of encouragement. It's really, really important. Don't ever underestimate the privilege it is to be by someone who needs encouragement, and give that. Be present, wholly present for those patients. That's what I learned, and that's now what I share with my faculty and my students.
Wonderful, wonderful. Those little instances make a big, big difference. Dean Lorraine Frazier,
Yes.
thank you so much for your time.
Thank you, Alex.
Thank you.